decompression?
It's going well. It went minimal swelling, almost no bruising, so I think it went really well for me personally, but I know it's different for every patient.
Yeah, you look awesome. I mean, you have almost no bruising and swelling, probably because you were really good about the ice. The ice is by far the most important thing, but maybe just luck too, like you said. I think it's going really well. So we did your right eye first and then your left eye around 7 days later, that's how I usually like to do it, 1 eye at a time, separated pretty close by. Since you had more proptosis, or kind of more of your eye being forward on the right, I did a little bit of an asymmetric surgery, so I took a little bit more of the bone out from the floor of the eye socket and from the lateral wall of the eye socket to get more decompressive effect on the right side. And then on the left, I left more of what's called the orbital strut, which is like a key support structure for the orbit, kind of through here, to kind of give you as much balance as possible. And since the left one is about 7 days more recent in surgery, that's why it'll be just a little bit lagging behind in the other one, but they'll probably catch up right around the 3-week point. So when this one is about 3 weeks out from surgery, that's when you'll probably see they're being perfectly equal. Although I think at this point they're probably within 2 millimeters or so almost perfectly equal. Yeah. How was your experience overall with orbit decompression?
It looked way worse than it felt, other than just being uncomfortable and not being able to get around on your own, and not being able to see if your vision's bad prior to the surgery.
Sure.
But for the most part, it's not a painful surgery.
Good.
It definitely sounds scarier.
Yeah.
So that's why the surgery is definitely worth it if you're dealing with the thyroid eye disease.
Yes. How long did that last where you were having difficulty like seeing enough to kind of like get around?
Probably 3 days after the surgery, but then it was fine.
Good. Did you think a lot of that was from the ointment, or was it just kind of just healing?
Probably just healing, and just my vision's horrible and I didn't want to put my glasses on yet.
Yeah.
But overall it was pretty easy process.
Good.
And I definitely, I'm already happy with the results, even though they're not fully where they're supposed to be yet, because it's still recent.
Sure.
But it's definitely worth it.
Good. Awesome. Yeah, I really like the minimally invasive way that I do it with like just a tiny incision in the corner. The older way to do the surgery has much larger incisions, and so the bruising, swelling, all of the healing takes longer. But this way, I think it's really great, particularly for younger patients like you, because it has faster healing, back to work faster, back to your normal life faster.
Yeah, no scars. I mean, right here, you can't even tell.
Yeah.
Once the stitches are gone, I'm sure you won't be able to tell at all.
Yeah.
But
I think it's gonna be good. Great. Well, thank you for being my patient.
Thank you so much.